All right, we're going to go ahead and get started. And for our next panel topic on integrating practitioner tools and evaluation, it's my pleasure to introduce Ajmal Aziz with DHS Science and Technology, Dr. Heidi Ellis with Boston Children's Hospital, Dr. Denise Bulling with the National Counterterrorism Innovation Technology and Education Center, and lastly but not least, Dr. Brett Kubicek, Canadian Center for Community Engagement and Violence Prevention. Mic's already on there.
Thank you.
You're welcome.
Yeah.
You're welcome.
Good afternoon, everybody. I know we're still catching people in from the dash from the lunchroom, but we'll go ahead and get started. Really interested in kicking off this panel here today with our distinguished speakers. I'm reminded of some of the comments that Brett made earlier this morning in terms of kind of demystifying the spookiness that comes with the utilization of validated tools and survey instruments. So I'm hopeful we can kind of, alleviate some of the concerns from the practitioner community once we hear from our distinguished speakers here. So perhaps we can start with Heidi to kind of offer up some intro remarks, and we'll kind of take it from there.
Okay. And Neil, do you have my slides by chance? Awesome. And I'm going to stand up, not because I love performance, but I can see the slide then. Okay, so we've been talking, super helpful and interesting morning, all about evaluation and outcomes and processes. And so I'm going to get much more specific and talk about 3 tools that are each in their own way are under development, but could be useful. So next slide, please. But before we do that, just want to kick off with a little multiple choice question. Choose the best answer. The best evaluation tool is A, psychometrically reliable and valid, B, free, C, named with a catchy acronym, or D, actually implemented. Yes. Okay. Then my work is done. Not that those other things aren't important too, but you can have the best tool in the world, and if nobody does it, it doesn't really matter. So what I'm going to be talking about are tools where there might be a reason for somebody to actually want to do it. I'm going to mention one at each of these levels: tertiary, secondary, and primary. And again, there are lots of ways to approach evaluation at these different levels. So these are just ideas and specific instruments. Next slide, please. Okay, so the first one I want to mention is a tertiary prevention tool called the Path to Resilience. Steve Wine is the lead developer with funds from S&T on this tool. And he mentioned earlier this 5R model that was about how do you work with individuals who are returning from conflict zones. And we collaborated on developing a tool that would be appropriate to implement in a program where you're actually serving those individuals, maybe in Kazakhstan, Kosovo. Steve used it there. And the idea is, if you can remember, that long list of outcomes that were things like social connection, or getting your healthcare needs met, or do you have citizenship? These were questions that were kind of central to what needed to be true in our theory of change for individuals to be able to reestablish themselves. And what we did was develop a tool that asked participants in the program about how that life was going in all those different domains. And it could do 2 things. It could help to guide the program to understand what was important to an individual, what kinds of needs they might have that were not being met. And then it could also help guide, are you seeing the change you need to see over time in that program? So what it does is it's a tool that informs the practitioner, helps make their job easier, helps make their work better, or at least more targeted on the needs the individual has. And so they're using it, and conveniently, it also helps you to evaluate, are you seeing change in those outcomes? So next slide, please. Right now, Steve is leading the charge on adapting this tool for the domestic context. And so I'm just going to briefly show you where the tool is in its development. It's soon to be piloted, but to give you a sense of what it looks like, there are some questions around basic needs. And again, the individual, the receiver of the services, can rate how much they feel like those needs are being met. Next slide. A question about managing challenges or overcoming challenges, like I can manage the demands or restriction placed upon me by the police and the criminal justice system. I know how to manage the current demands and challenges in my life. Next slide. A social network, and this was complicated because we want to think about pro-social social networks. Sometimes people have strong ties, and that's partly what might be pulling them into an extremist network. So thinking about networks with people who do not believe violence is necessary for social change. There's a series of questions here. My family accepts me as I am. I have friends. Next slide, please. Identity. I like who I am. I believe I have opportunities for a good future without hate or violence. Next slide, please. Okay. I'm going quickly because I was told to be brief, but what I want to do is make sure you know Steve's over there. Again, this is in development, but we welcome sort of a collaborative community around building this, using it, and making sure it's useful. Because again, the idea here is if it's useful to practitioners, they will use it, and then we will be able to know something about whether it's working or not. Moving to secondary prevention. Those of you who didn't sit at my table missed a rocking good discussion around the TSAM, but I'm going to give you a brief primer here. The lead developer for this is Emma Cardelli out of Boston Children's Hospital. So this is a clinically useful tool that offers mental health professionals a collaborative, client-centered approach to violence risk assessment and management. Lots of great tools looking at risk assessment, structured professional judgment. This is different in that it's really focused on, okay, but what then? What are you managing? What is the focus of your treatment with the individual? This was informed by an evidence-based suicide-focused treatment, if you know about the CAMS, and then a thorough review of research on risk and protective factors for targeted violence, looking at other existing tools, getting input from many people who are in this room, other subject matter experts, smushed it all together and came up with this tool called the TSAM. And the idea would be this is something for a mental health professional to use when they're meeting with an individual who's at risk for terrorism or targeted violence. The first pass is a very broad, detailed assessment that you might, any initial assessment is going to be psychosocial assessment of how they're doing in life. This has some additional considerations based on this population. And it has the part I'm most excited about, Section A. If you move to the next slide, Neil. The first thing you do is a very collaborative assessment where you literally sit down next to the client. Don't put your arm around them, but you sit down next to them and you talk with them about these potential psychological drivers. And these, again, come out of the literature of potential psychological drivers of terrorism and targeted violence. And you ask them to rate to what degree they experience these. So psychological pain, stress, agitation, anger, thrill-seeking, disconnection, dislike for others, dislike for self, hopelessness, sense of importance. So the individual rates that and gives you a little more information about how that plays out in their life, and then talks with you about which of these feel most important to them. Like what are they experiencing that is most salient? This helps to define the focus of your treatment, and then you can re-administer just this first brief section to check in about these psychological drivers over time. I'm going to briefly show you the other sections that, again, this is more kind of what you would do at the initial interview, not repeated, but we have lots of additional aspects to add to the clinical interview. Next slide. Then there's collaborative treatment planning. So all those questions are actually driving the focus of your treatment. Next slide, please. There's a post-session evaluation where you're thinking about mental status and documenting, like, is this person safe? This is really important because it's also protecting, remember that useful part, protecting the liability of the individual providing the treatment because you document your thought process. Next slide, please. Oh, okay, sorry, go back one. So that's the TSAM. And again, that first section guides treatment so that when someone walks in the room, maybe every week, every other week, you sit down and do that together. And you have two things. You have clinical information that guides what you do in session, and you have some outcome information to say, am I making change over time in the variables or the factors that I think are most important related to violence? So again, a useful tool at the secondary prevention level. That was rapid fire. There's lots happening in the development of that tool. If you are someone who works with clients and are at all interested, talk to Emma, talk to me, talk to Neil. We're launching Neil's making signs at me. We're info sheets over there. And we have learning communities coming up that we're launching. Okay, next slide. The last tool is at the primary prevention level. Again, complicated to figure out how to evaluate here. Broad strokes, you can think about proximal factors. So are we making change in risk and protective factors that we think are related to an outcome? And the idea would be, if you do, you're also making changes on this ultimate outcome, maybe risk for violent radicalization, or within a community, support for violent radicalization. So this is very much under development. So this is more notional than anything else. But the idea is we are taking risk and protective factors, instruments that tap into the most potent risk and protective factors for support for violent radicalization. And we are building a sort of brief battery out of what used to be a much more longer, more complicated battery. I love complex, cumbersome batteries, but participants don't. So we're distilling it down. And the idea will that this will become a tool to help communities plan around which risk and protective factors do they most want to target in their community. Which risk factors maybe look most concerning? Which protective factors could use bolstering? And this can help their thinking around, okay, what kind of primary prevention programs do I want to launch in my community? What can I draw from that's already out there that addresses some of these risk and protective factors in an evidence-based way? And so I can implement it and target these things that are showing up in my community as maybe a particular need. Then over time, you could go back and re-implement to see if you saw change in those proximal factors, whatever you targeted, the risk and protective factors, and potentially even an outcome like support for violent radicalization, and be able to see whether the change you made in that risk and protective factor is what's driving the ultimate change. So again, this is in development, but it's coming out of a study that we just ran called Strong Communities. And the idea, again, is to support communities using it as a tool to plan, how do I focus my intervention so that it's useful to begin with, and then you're queued up to be able to implement later as an outcome evaluation. Next slide. An example would be maybe we assess, maybe we assess civic engagement, trust, belonging, procedural justice, and a community decides to focus on procedural justice as a particular need in their community. Then you could look at that again later to see if you have made change in that. Next slide. Again, so that's used as a planning and evaluation tool. Where is our community strongest? Where is the greatest need for addressing risk and protective factors? What's maybe subgroup like youth do we want to focus on? And then do we see change? Next slide. So in conclusion, the best evaluation tool is the one that is used. And the best way to get an evaluation tool used is to make it useful. I think each of these tools in their own way does that. So if you're interested, just please, these are the folks to contact. And we look forward to collaboration with you.
Thanks, Heidi. That's a really good segue, I think, to also, Denise, who's done a lot of work in the primary space as well. So, we just heard about, some tools that are out in the field, some tools that are in development right now. So Denise, interested to kind of hear your comments in terms of how you're able to utilize these things to kind of help inform some of your efforts right now.
I don't have any slides. So that was awesome. Thank you, Dr. Ellis. That was amazing. I go back to, first of all, I'm Denise Bowling. I'm with the University of Nebraska Public Policy Center, and we are affiliated with the InSight program, which is the National Counterterrorism Innovation Technology and Education Center. Did I get that right, Andrea? Okay, good. It's important for you to know that in my background, I am a mental health clinician, but I'm also a practitioner in the area of targeted violence and an evaluator. And I do lots and lots of program evaluation. And I'll tell you that I've heard the word research and evaluation tossed about fairly interchangeably here today. And I go back to a quote that's on the Center for Disease Control's website from Michael Quinn Patton that says, research seeks to prove and evaluation seeks to improve. And that helps me stay grounded in what evaluation is. Though we are trying to maybe prove something works, really the purpose of program evaluation is to improve your programming, to make sure that whatever it is that you're measuring measures the right thing. What you want it, you're anticipating outcomes, as we heard about this morning. And so the question is, are there tools out there to help me measure what I want to measure based on the program that will help me improve it? So I think part of that then is beginning to say, what change do I expect? And whether it's from the logic model, the type of evaluation you're doing, but you're looking for some kind of change or you wouldn't be doing the work. So once you identify what that change is, you really have to think it through. I'll give you an example before you choose a tool, by the way. I'm working with Brett Steele and her group to do a program evaluation for the Invent to Prevent program, which is both a high school and college competition to get innovative ideas from young people related to targeted violence prevention, reducing hate, and some of those things. And I asked them early on what changes expected. And initially, I mean, truly, they have made some amazing anecdotal changes in people's lives. And those young people go on to do great things. However, this is not a longitudinal or over time evaluation. This is 15 weeks. At the beginning, from the beginning to the end, what change can we expect? And we thought about it and talked about it with them. And they started by saying, obviously career and life goals, but it's difficult to track that change from the beginning to the end. So then Brett and the Adventure Partners group talked about how it also develops not only knowledge about targeted violence, but also maybe a sense of social responsibility, kind of a moral compass change. They become good employees, good citizens, leaders. They learn discipline, they learn time management. There's all kinds of things that they learn. So we kind of started by saying, well, what can measure that then? How do you measure that? Well, some of it's kind of self-efficacy. So you go to the Google machine and you go to Google Scholar and you look at some of the other EBSCO and some of their databases and say self-efficacy and tools or measurement or survey and figure out what's out there. We did a summary of things. We looked at it. We talked to the Invent to Prevent group about all of the program staff about the different things they could measure. And I said, it's close, but it's not quite. So really, we're talking about their work performance and what it means to be, really good in that sphere, along with that moral compass and taking responsibility. So we looked again, narrowed the search a little bit. I found some articles, which is what you need for a validated tool. Somebody's looked at it in the research to prove that it works. And we found some questions that we could insert into a survey they're already taking. That's the key. We don't want to burden by saying, here's a 20-page thing we'd like to fill out at the beginning and at the end, and maybe 3 months after. No, again, we want to take what they've got already, see what we can do to improve the questions, help them improve the way that they're measuring it, so that in the end, when the evaluators go away, they can continue to track these things and see if they work. Now, we are, in addition to that, having a comparison group, and we're looking at high performers, not high performers. and looking at all of those, pre and post to see if there's a change. So there's a lot of things you can do using a tool, but you have to match that tool to what you're trying to measure. In rural areas in particular, which is where I do a lot of my work, any tool is looked upon with suspicion. And so you have to find ways to integrate it with what's already being done. I think the other thing that I would say is that when we think of tools and we work with the partners in the community or within programs to find the right tool, you have to start with, as I mentioned earlier, what are you going to measure? And I saw a cartoon about evaluation that has a big, like this giant formula, mathematical formula on one side on the left, and on the right, it has this solution. And in the middle, it just says a miracle occurs. And that's what we're trying to look at, the miracle. What is that miracle? How do we describe the miracle? How do we measure the miracle? So you can find tools to measure just about anything. Before I pass it on, I would say that you want to make sure you've got more than one article, more than one person has looked at something, that it's culturally appropriate. The last session, people said it needs to match your population. If it's normed on a group of prisoners, adult male prisoners, and you want to use it for a group of high school students, who've never been in trouble at all, I'm not so sure that that tool is the one you want to use. You have to make sure that it is appropriate to the population. In summary from my remarks, I'd just say that there are a lot of places where you can find the tools. You can look at tools that are in beta form, which are being approved right now, and help pilot those and build that literature. You can also look for those that have already been normed and are already proven, but find a way to use them so they improve your program. That's all I got.
Thank you. Brett, before I pass it over to you, I think it's important for kind of the folks here to kind of understand, your role in kind of co-leading the 5 Research and Development Countering Violent Extremism Network, which has been stood up since 2015. And I'm reminded of, we've had 8 years now of this network, coordinating and just, leveraging work that, our respective governments are undertaking, and evaluation research continues to be on the top of that priority list. Validating some of these tools continues to be at the top of our priority list. So curious to hear, how you all are kind of tackling this within the Canada Center and working with your stakeholder group.
Sure, thank you. Yeah, I guess part of my answer is going to be, yeah, I've been at it for more than just that 8 years. And to me, Heidi, your presentation shows how far we've come as a field. So I worked for the Government of Canada within Canada's version of a DHS. Your acronym thing, we got it exactly wrong. The Canada Center for Community Engagement and Prevention of Violence. Just do the acronyms like Soviet volleyball team. But basically in some ways what we have become over the years is kind of like a domestic capacity building program for preventing and countering violent extremism. But when I say that, I mean, we support primary, secondary, and tertiary prevention. We support research to better understand the phenomena that we're trying to deal with, and we support measurement evaluation. And I would tweak your research evaluation relationship. And part of what I mean by why, just like how even just the core philosophy of your tool, Heidi, is that it has been such a barrier in early stages that we were so focused on trying to measure the risk of violent extremism with our tools, and then thinking about evaluating effectiveness based on that, where now we've come such a long way to think about violence risk in a much more holistic way, about the person in their place, what is their environment, what are the risks, need protective factors, which has opened up so many possibilities in terms of thinking about evaluation and metrics, because it's also by having a better understanding of the phenomena, what pathways look like in that more holistic sense, it's allowed us to look at a wider range of tools. Like the programs we're supporting in Canada, some of them are more led by people with a social work background. Some of them are more led by people with a clinical health background. And they're bringing tools with them, but they need that sort of research support to say like, okay, sometimes for certain clients, it really matters, you know, their history of trauma, their history of exposure to early violence or suicide risk is a huge thing for a number of the clients that our programs are dealing with. And then of late, there's, you know, mini panic of the number of people not only under the age of 18, but in early stages of childhood development. And there's this, the field has become so much better at being holistic, but we're also struggling with a constantly changing environment. So it's part of why this international partnership matters for us so much, because, you know, Dr. Legault mentioned earlier, it's difficult to study this stuff scientifically with small populations, changing populations, still learning even how to do practice in this space. So it's yeah, we've had this fortunate connections across borders, so to speak, to try and harness what we're learning together. And I'm pleased to see that you do have Canadian partners in your project, of course. But you know, I just that shift to thinking more holistically about what exactly the pathways look like, drawing from the practitioners themselves, the expertise they already have for thinking about this, and then trying to weave it into our field is yeah, again, why I feel like your exercise is kind of like crystallizing what we've been trying to do together for years.
No, Brett, you said something kind of interesting in terms of, you know, the difficulties in being able to measure something that, you know, hasn't been observed or, you know, taken place. So I'm curious to hear, you know, from the three of you in terms of how you kind of take that into account when you're, you know, doing program evaluations.
Trying to prove that something didn't happen because you did something is the age-old problem of prevention. It is something that every prevention field has struggled with. So you look for other benchmarks and other things. If you're increasing protective factors, if you are changing opinions or enhancing awareness, you know, sometimes we look for population-based numbers that are related to, in some way, the issue. For example, with suicide, we're not only tracking suicide, right? We're tracking the number of times that people attempt suicide. We're also looking at, you know, the rates of suicide for different age groups and different high-risk groups. And we're looking at then some of the, you know, some of you working in schools know that we look at school climate. We look at proxies for those things that cause people to feel hopeless and helpless. So in the same realm with violence prevention, I think we are going back to what are we trying to do that will, you know, if we're looking to enhance particular protective factors, how are we measuring their presence or absence in the very beginning? And what are we going to look at as a proxy if we can't get that actual factor? What are we looking at a population base? So it's not a new issue. It's one we struggle with in every field, in the field of substance use or in the field of mental health. If you're preventing something, you look at those other things. Smoking, we now measure not just people saying they're smoking or not smoking, but you're looking at the diseases that result from smoking and seeing if there's a decrease in those rates. So what are those proxies for violence and targeted violence that we can look at a population level? I think we're still trying to kind of figure that out as a field.
You have something to add?
I might be stretching the practitioner tool bit a little bit, but you know, I think there were several comments made earlier today, Wendy and among others. And Steve's, you know, started us off, like part of his focus was on process evaluation, but in a sense, what we've seen over the last few years in Canada and elsewhere is how much the sort of the learning and feedback mechanism that a process evaluation is, if it's happening in almost real time with the practitioners, how it can benefit practice. So an example, again, on Rick's panel, like and Brett made the point that if you protect privacy, it can be hard to see the impact of, say, online related initiatives. We've on a couple of occasions worked with Moonshot and others to do online related interventions, but the most recent work involves them partnering with you know, local intervention practitioners on the ground to sort of try to use online awareness raising to reach vulnerable audiences to then help raise awareness about local services that might be available to them. And you can get a few more metrics there if somebody sort of self-refers into a program and they along the way say, oh, I saw this ad, you get some data. But one of the kind of things we hadn't thought a whole lot about until the evaluation was going was along the way, the Moonshot experts were helping train social workers about how to do social work online and do it safely, and how to work in the online environment when these really deep experts in working with vulnerable people were finding themselves, especially these days with some of the things that are happening online. You know, we were, as a funder, we're so interested in the opportunity to support this referral option, which we still are, but hadn't thought a whole lot about this, in a sense, protective benefit, that because the evaluation piece was there, we were able to say, oh, that's something we need to make sure we value. And in a current example that's for us, I hope we can draw on, given what's been happening in countries like ours since October 7th. We've been funding a sort of a collaborative project between a municipal police service and close to 30 different community organizations to co-develop a training package with respect to hate crime and CVE. It hasn't even been delivered once yet, but the process of working together has created trust amongst between community organizations and with the police in ways that hadn't been there before, that they then had with them when October 7th happened and the aftermath. And then talking to the police service, like, no matter what happens with the rest of this project, we now have built through this exercise, in a sense, a community protective factor that hadn't been there before. And we want to use the process evaluation to amplify this and show others so that others can benefit from it. So in a sense, bending the evaluation tool practitioner thing, but in thinking about the just what we've heard this morning and you know, that making it part of the everyday work is something I wanted to flag.
No, Heidi, I'm reminded of your presentation now where you kind of talked about some of these tools that, you know, both yourself and Steve are utilizing in terms of some of the work that you're doing in the tertiary space. There's some tools that are already in that you're, you know, developing, you know, as you kind of go. How do you validate these things, and how, you know, how do you just ensure that you're using the right one in terms of applying it to, you know, what you're studying and working on right now?
Great question. And validation is, you know, there's a whole world about how you go about doing that. And the basic idea behind it is you want to make sure when you use a tool that it's measuring the thing you mean to measure. And this gets really tricky because if no one's figured out how to measure that thing, then what do you reference? Like if I want to make a new measure for PTSD, I'm in great shape because I can develop my new items, give it to someone, and then give them the gold standard interview around diagnosing PTSD. And I can say, my nice screener tool works because it gets the same, most of the time it gets the same answer as this gold standard diagnostic tool. Well, if you're just kind of starting measurement in a field, you don't have a gold standard. So what do you compare your instrument with? And I would say that's where, you know, you have to get kind of creative. And some of it is around really talking to the users, going and saying, what did you mean when you answered this question? And did this capture your experiences accurately or not? And really getting some of that qualitative information to help you understand if your tool's working. And then some of it is going to, over time, what you're going to need to do is implement it. And if you can, there might be other instruments that have been developed that you can bring in. Like at our table today, I was disappointed, Steve, that you didn't call on our table for our outcomes question, because we had a great one. And Jim was talking about daily living skills and some tools that he knows that can adequately measure that. So in our tool, we have a different way of assessing it. It's much briefer because we can't have tools for every item that we're talking about, but we could then implement those daily, do a study where you implement that, reference back and see if, yeah, we're getting pretty good agreement with this single question. We get pretty good agreement with this 22 item battery that has been shown to capture that. So it's a work in progress always, but the idea is it's important because otherwise you might be assessing something and you think it's measuring what you want to measure, but you don't actually know. I think that anecdotally, or as an aside, I think our current tools that measure radicalization, support for radicalization in the community, I think there's a lot of fuzziness around what those are actually capturing and whether it's capturing general violence appetite or whether it's capturing something different in maybe a liberal population that has concerns about police brutality than it might capture in a more a different population. So those tools need some refinement if we're going to be using them to better understand sort of levels of support for radicalization or terrorism and targeted violence in a community, which could be done. But again, we don't really have a great gold standard to back them up against. So you got to be a little creative in the process.
Denise, picking up on what Heidi just said right there, do you have any recommendations in terms of tools that are already out in the field that you've been able to kind of apply in some of the work that you've, that you're leading right now? You talked about I2P, so curious to hear about your perspectives on that.
Yeah. And again, it's very specific to what you're trying to measure, right? So I could recommend a tool, the same tool that we're using with the Invent to Prevent program, but it may have absolutely nothing to do with what your program is trying to do. So what I would say is that there's a lot of, at the individual level, the structured professional judgment tools, and the tools like Heidi is talking about, that you can maybe aggregate some single outcome from those tools that maybe can help you if they're already collecting them. They're not already collecting them, making somebody do that, it may be counterproductive. It may change the calculus so much that it's difficult to do it. So the recommendations I have for you are related to whatever you're trying to measure and to look at them. I don't know of too many tools, particularly at the community level, that you could administer and have that come up and say that you're making an impact on targeted violence or preventing targeted violence just by administering a tool. But as a program, you may have things that you're doing that there's perfectly valid tools out there already that you can choose and use to prove what you're doing is working and to improve your program. So my recommendations are not for specific tools, but to find the right tool that fits your program and what you're trying to change and measure. And if you can't find a tool, be careful about making stuff up. So you may also find something that's close, that is validated, that you can use from some of these, some of the tools online. Again, I would go to Google Scholar. I would go to some of the inventories of the different resources. There may be a section of Heidi's tool that applies to what you're doing, but not the whole thing. And, as some of the previous speakers have said, by staying narrowly focused, you might be able to use sections that are validated. So my recommendations are related to being specific and being, I don't want to say targeted because that's a loaded word, so to speak, but being very specific about what you're trying to measure and then looking for tools that have that aspect. I wish I could give you one tool that is perfect, but then I would be writing a book and making a lot of money about that tool. So that's not going to happen in my lifetime. But I would encourage you all to be creative, yet grounded in what we know.
Just listening to you makes me in parts reminding me of the importance of a community of practice. One of the very first things we supported when we launched our program around 2017 was the Canadian version of the PPN, the Canadian Practitioners Network for the Prevention of Radicalization and Extremist Violence. Partly just because of this core intuition that as a still young field, where often practitioners are working in relative isolation, they're dealing with this fringe problem that a lot of people don't get or don't trust or are too afraid to engage with. And so having those connections is important, but this is also true for researchers and evaluators. We had this great early example of what, do that searching, but the more we can find experts from different fields who know enough about TVTP, to use the American lingo, to consult with about this is important. We have one of the very first evaluations we funded was of a multi-agency model in Toronto and a similar one in Calgary. And the academic researcher in charge of that evaluation at a conference we held, about 2017 as well, I think, benefited from having people like Steve Wine in the room, because she had this core idea. She wanted to try and find a way to better measure how well a multi-agency prevention program is working. And I don't know if it was Steve or Dave Eisenman talked, well, there's this coalition health measure thing. There's actually people who've thought about this, and there are metrics out there. And she's like, mind blown. She's like, oh my God, this is the best thing ever. And like, do the search, but that value of having networks like this to run ideas by, because there might be something that's already there, already validated, that might need a little work to make sure it's appropriate. We have had this history in the field of CVE of drawing other tools too quickly. About 10 years ago, there was a burst of, oh, let's just copy paste wraparound gang prevention programs to CVE, when there was very little work done to see if are the risks, need, vulnerability, protective factors appropriate for that. We're a lot better now. Like, we know more about the pathways, so it can be more thoughtful. But, having those experienced experts in the room who can, bounce those ideas off as you're trying to find that right fit tool for your context, I think is also really important.
So we heard about, kind of what that process looks like for kind of validating the tools, ensuring that the right ones are being used for, our respective, use case here. Switching gears, curious to hear your all's thoughts in terms of reliable survey instruments and how we can kind of apply those to the various kind of research questions that you all are aiming to answer right now. Denise, you kind of mentioned, the anecdote in terms of the survey instrument that you are looking to utilize with I2P, that obviously, as kind of the organization that was funding that, kind of gave us a little bit more confidence in terms of, things that you were looking to kind of update in terms of the various questions without adding on something, another layer of instruments or, things out there. So, when we think about, increasing, our level of just, again, confidence in terms of the utilization of these survey instruments, curious to hear about your recommendations and kind of comments on, what you've seen in the past.
So I think there's a ton of literature out there in the research world about one and done good ideas for surveys and survey tools. So somebody will say, I want to measure violent extremism, and they have their, Denise's pretty good tool. And I go out and I pilot Denise's pretty good tool, and then I come back and write an article about it. And boom, it's in the literature. But it's not necessarily compared to other tools. It may not necessarily be measuring what it's saying it's measuring. And Denise's pretty good tool, looks good to Denise, but nobody else is using it. There's a reason for that. So I look for something that's been done more than once by someone other than the developer. So it's not just the person who's developed the tool that's writing about how great it is, but it's others who say, okay, you say this is great. Let me go out and replicate what you did, or test it with another population and see if it holds water, or test it against another instrument and see if it is actually doing what it says it's going to do. And then I'll look for a tool that also says, okay, you used it with this population, but does it cross cultures? Is it something that you can use with more than one culture, or is it very culture specific? Does it need to be adapted to be cultural specific? And do some of the questions not measure what they say they're measuring in that culture? And so when I look for a tool, a survey tool, I look for those that have more than one article, that have some numbers behind it, that it's been compared to some tools if they have existing measures. And then I will say, does it work for my population? And if I come in with some additional questions from a tool that is validated already, it adds a little gravitas to the findings. And I don't ever like to just go in and say, do this tool, but instead, I like to have it be a collaborative process with the group that, with the evaluation group that you're working with and the program group, and also have that integrated into, as I mentioned earlier, integrated into the work that's already being done. This morning, we had a question from someone who says, how do you do this when you don't have a lot of people and all of us are wearing 50 different hats, and we don't have someone focused specifically on evaluation? And the answer at the time was to, integrate those pieces and parts. So evaluation is just part of the way you do business. And you may have somebody who's good at pulling all that stuff together for you, but collecting all the data becomes just part of the way you do business. And then I think the other piece of that is then, if you use a tool and you find something different or it validates the tool, I think we all have an obligation to share that with each other in a community of practice, saying, I've used this, it works, it helps, or it doesn't, and share that with each other. Is that, you think?
So this, I guess, is partly, again, not all roads go back to Steve Wine, but the question this morning about research questions, a lot of those studies are about validating the tool itself as a tool. Like, what's the iterator reliability? What is the evidence behind the particular items? One of the Campbell systematic reviews that I would say tried to fund, well, we did fund it, but we had a concept behind it, which was we wanted a review of, and Dr. Jihan Rabah used this term this morning, but the fit for use of risk assessment tools. Like, how are they actually fit for purpose? How are they being used by the practitioners on the ground? To your point, there are research methods to look at that, and we don't really use them much at all yet. It's something that we need to keep doing the validation work and the iterator reliability work. But in addition to some of the tools being too based on convicted offenders of particular age groups, those tools are used in different ways by different people. It's good that we're seeing more emphasis now on things like case formulation and scenario planning, like the meaty work of how practitioners actually use tools, but we're still not very good at using the tools of research to understand how frontline practitioners actually use the tools. Are they using them appropriately? Are they improvising? What does that mean? It's partly a self-tasking there, but hoping that as a field we can start to sort of look even more closely at that, just how things are happening on the ground, and then use that to help inform, exercises like yours.
Can I just add one more piece of the conversation? Really appreciate all that you both have said. Coming out of a more medical background, one of the things we talk about sometimes is statistically significant difference versus clinically meaningful difference. And I think that's important to, even if we forget the medical jargon, but it means something. Like if we're doing a survey, you can have a huge data set and find all sorts of associations and find all sorts of like tiny changes that don't actually mean anything in terms of like how a program might affect a person's life or not. And so I think it's really important that we remember we're looking not just in research, we need to think not just about statistically significant changes or findings, but also sort of practically meaningful levels of change.
Do you guys have any concluding remarks that you want to hit up before we open it up for questions for the folks on the online?
Well, I would like to echo what you were saying, that this panel is making me feel like, oh my God, we used to be a baby field and we're like getting somewhere. It is really exciting to see the research. I mean, over the past, maybe 15 years has grown so much. And instead of these sort of blunt instruments and floundering around with methods, like we're really beginning to make some progress. And I'm just very excited to see that and be a part of that. So that's all I'm going to say.
One thing, and that is that the tools, and as Heidi said, the statistical significance is important, but the stories are also important. So qualitative data, in addition to your validated tools that you're using to get those nuanced differences, the stories also are important and help illustrate what those changes really are in people's lives and in communities, in the way that they work. Hello?
Hi. So would you have any advice for organizations that have to develop tools that have not yet been created for their needs? You talked about not necessarily having a gold standards. What if you want to set it?
I would ask the question back, what kind of tools do you need and want? And why are you developing tools? I think that's the question that you ask first, is whether or not it needs a tool, whether or not there's something else that you can look at as a proxy. And if not, I would suggest that you hook up right away with somebody who's got research credentials, because that's in the prove stage as opposed to just the improve stage. If you feel like you have to develop your own tool, and I guess I'd pass it to Heidi because she's developing a tool. You can give her advice.
Can you just say, developing a tool, and sorry, I know it's exactly what you just said, but for what kind of a tool to measure what? Because you said, where's the gold standard, but I didn't quite understand or hear what you were trying to measure.
So this is more a general question, because as we're growing and expanding the field of TVTP, we have to find new ways of measuring the types of impact we can have based on new types of engagements and new collaborations between different sectors. And so for that, we have to find a way that is both standardized, but can still capture the engagement of different stakeholders in our work. So for that, particularly coming from CP3, how can we look and see how we can measure the effectiveness of our engagements with our stakeholders across the board? So not just different sectors, but also potentially at different levels. Are we talking with community organizations? Are we talking other government agencies, nonprofits? Like there are so many different things that need to be captured, and perhaps there's tools out there that we need to look into, but maybe we'll need to do a little bit more than just refining them and kind of creating something that is better suited for our specific needs.
So I don't know if I'm directly answering that question, but what your question made me think about, and Emma and I have been working on a paper around this. There's a model that has been used to evaluate multidisciplinary teams. and it comes Wooten, Wooten is the guy who published the paper that we're referencing. But the idea is a good multidisciplinary team, you actually really need to be evaluating both process and outcome, because you want to know that the team has representation from different disciplines, that you're speaking a common language, that there's trust, that you know, all those things need to be true for the team to be effective. And you want to know that you're having the right kind of impact. You could have an awesome team that loves each other, but you're not actually getting referrals or doing the thing that needs to get done to help someone get better. So you also need to be looking at outcome. And then if you kind of imagine, like if you graph it, you can imagine a team that might be high on process, but low on outcome. And they're sort of an emerging team, like maybe they're just getting going, and that's okay. That's sort of where they need to be, but their push is going to be, how do we start making difference at outcome level? And then you might have teams that, like, gosh, they're just great at getting good clinical outcomes on kids that come through, but they really can't talk to each other. And the surgeon and the, and the anesthesiologist just don't ever talk, and they would be poor on process and high on outcome. And that would be a more traditional model, actually. Like, that's what care often looks like. And so to push the multidisciplinary field forward, you have to be in that upper right-hand corner where you're attending to and measuring both process and outcome. And I think you were talking to that complexity in what you were saying.
I just, if I could jump in, reminding me of a bit of an aha moment we had ourselves, a few too many years ago. But yeah, working for the government of Canada, the sort of evaluation tools they give you as public servants tend to be for big programs with way more money and way more clients. And they just weren't that helpful. And an evaluation colleague said, oh, well, there's this whole fit for use approach to thinking about evaluation. And it's fundamentally about, are the services you're providing helping the people that you're aiming to help? And it's just, in some ways it's very intuitive, but there's this suite of methods and approaches for thinking about how to use surveys, how to use interviews, how to use data gathering to get at that more fundamental, like, how is a program, are you helping the people, doing the work? Is the research you're doing useful for them? Is the evaluation actually helping them? Or in too many programs, it's not helping anyone because it happens too late and sits on a shelf and no one learns anything. But it's a different way of just thinking about it. And there are methods and surveys to sort of, they aren't specific to one field, but it was like, oh, great, there actually are methods out there that are much closer to what we're trying to achieve than are commonly, the how many people showed up at your event, how many people got their tax returns and stuff like that.
Okay. This is maybe a quick question, but it may also sound like a bit of an odd question. And I'm also putting on my clinical social work hat. With the goal being the development of these instruments, and again, the idea of integrating practitioner use, and the goal being eventually to get these more dispersed in more sites, how do you approach clinicians who sometimes look at tools as, well, these just negate my clinical judgment? I think several of you have talked a bit about how you push back against that, but how do you deal, either in terms of training or other things, with the clinicians who are saying, I got all this education and experience, and tools just take away the use of my clinical judgment?
Okay, well, first of all, I would say, yes, clinicians get a lot of education and experience, and almost never is it in how to deal with someone who is at risk for terrorism and targeted violence. And I think clinicians know that. We did a national survey of providers working within the National Child Traumatic Stress Network, and they said, yes, I can handle high levels of risk of, like, substance abusing, gang involved, sexually acting out kids, but I don't do terrorism and targeted violence or at risk for hate crimes. That's not my thing. And so we need to build capacity. And I think people do know that they don't exactly know, is point one. And so what we're seeing is that there's some sense of relief, that there is some guidance to follow, and that's being well received. The other thing I would say is that this sort of collaborative assessment tool is really not a checklist that takes away clinical engagement, relationship, judgment. It's meant to help you build that and help you to have those hard conversations. Very few clinicians actually assess whether someone wants to hurt someone else. We're pretty good now at assessing whether that you're going to hurt yourself, but very few clinicians feel comfortable asking if you might justify violence, you might engage in violence, and to what degree, you need to be attending to that. So I think what we're seeing is that this is not supplanting clinical judgment and relationship. This is helping to build relationship around these difficult conversations with clients that may not be particularly interested in going there with you.
I'll just add quickly to that. What we know is that clinical judgment is about the same as flipping a coin. It's about 0.5, 0.6, like area under the curve, particularly for violence risk assessment. And if you add, if you look at actuarial tools or those tools that take your clinical judgment away, they're a little bit higher. But if you put them together in a structured professional judgment tool, you get almost, it's like a 0.8, an 80% hit rate on your, whether you get it or not. And I think selling that to clinicians it begins in training and getting them used to and comfortable using those types of tools. The other thing that I would mention is that clinicians, some people aren't cut out to do that work. And the ones that aren't cut out to do the work should be able to recognize that and opt out and have referrals that they can make to their colleagues who are more comfortable in that work. And I don't think that every clinician should be expected to work with every population and do it right all the time. So there's some self-selection that's going on. And in this field in targeted violence, it hasn't been necessarily a well-defined option for all of us as clinicians at this point. So we're starting to have to base that on what, Heidi was saying, looking at some of the models that have worked in suicide prevention and getting our clinicians comfortable with that in the area of targeted violence.
I feel like we're finally getting to a better place, but one of the problems I think that was a barrier along those lines, at least for the CVE field, was a bit of a failure to communicate, but also just a failure in usage. Like we talked about some of the big tools were framed as structured professional judgment tools, but it was all about the checklist. There was almost nothing about the case formulation or the scenario planning or the rest of the case management process. Once you start bringing that more to the fore, I feel like there's more, it's easier for, well, I'm speaking as a non-clinician, so I shouldn't say this, but what I see is more comfort in, okay, I see where my expertise fits. And so even just like making it clear that there's a structured assessment tool here, but then it's only been in the last few years that you even hear those phrases, case formulation, scenario planning in our field. Like, so I think even just putting more emphasis there helps, I hope helps make it easier to do that bridge building.
And we have time for just one more question. Here you go, Susan.
I'll make it easy. Heidi, I was wondering with your tool, given that it is for clinicians, it's not a general purpose tool, what are some of the ways we as the field should think about the ethics about using these tools? Can we look to other fields to give us some suggestions? I mean, it sounds like what you've developed would not be appropriate for anyone to use. It wouldn't be open source, but there are tools that could be useful to any community organization. How could we think about this as a field?
Thank you for the question. So we're still very much in the learning phase. And so, and again, Emma's leading the charge on this, but we are starting by working with individuals who are licensed as mental health providers and really trying to understand how does this tool work for those individuals in the context. And there's, I mean, there's a lot of infrastructure built around being a clinician in terms of licensure, in terms of insurance that you're covered by, et cetera. And as we're kind of wading into this field, I feel like it's important that that we really figure out how it works in that context first, which is not to say that there aren't going to be adaptations or elements of this that could be very useful in other contexts. And even in the early pilot that we've done over this past year, we're finding like there was someone who does emergency response and was pulling it out in a sort of roadside context on the fly. And that was a whole new idea of how to use it. It's not the sort of repeated sit down with each other over time assessment that it was developed to be. And there were ways in which it was helpful in that context. Again, that was a licensed provider who was in our pool. So I think over time, it'll be really exciting to see what pieces might be appropriate in different contexts, but we are starting slow and small and in our lane, which is with mental health providers who are licensed.
I'm going to give you one quick example. Cognitive behavioral therapy, manualized cognitive behavioral therapy has been the purview of clinicians over the years. In the disaster response world, we developed psychological first aid, disaster psychological first aid, to take some of those skills and teach people who are not licensed how to support each other after a disaster. And then what we found is that during recovery, eventually psychological first aid is not enough. So Dr. Melissa Brimmer said, okay, well, let's take what we know about cognitive behavioral therapy. Are there elements of that that can go down and have people who are not licensed work with other folks? And they took several elements of, a more manualized therapy, and they structured it so that it could be delivered by non-licensed personnel in certain circumstances. And it doesn't take a license. It doesn't take lots of education. It takes some education to understand the tools and then apply them. And I think eventually those tools that Heidi's developing will reach the maturity stage where they can branch out after they understand more about how they're used and what they can measure. But there is a natural evolution and models in different fields that we can use to kind of take some of that down out of the professional sphere to the more practitioner level.
I think that gets us right at time here. So please join me in thanking our distinguished speakers.